I spoke about the incidence of cardiovascular disease being on the rise, basically my concern was more focused towards the incidence of heart attacks. Now, a heart attack occurs when the arteries supplying blood to the heart are completely occluded by a clot. And this is the reason why the certain portion of the heart muscle is deprived of blood supply and oxygen, and it starts getting necrosed. That is the time when the patient complains of chest pain. It may be a heaviness or a pressure-like sensation, not only on the left side, but it could also be on the central part of the chest or the entire chest. It will radiate to the left arm, shoulder, the chin, the jaw, and sometimes they may experience throat burning as well. Sometimes they may also complain of epigastric or upper abdominal discomfort, and they think that it is an acidity or a gas problem, and that is the reason why they go late to the doctor. So the first thing in the mind of the patient is that this cannot be a heart attack, it must be due to some gas problem. And this is what is the basic reason of causing delay in the patient reaching to the doctor. So I think that people should not go into the denial mode. Instead, they should go up front and at least get an ECG done. That would help in the diagnosis. And then, of course, further treatment and further management can be done. A 2D echocardiography can be done, or a stress test can be done. If there is a high index of suspicion that the patient may be having blockages, then the patient can undergo a coronary angiography, which is a gold standard test for detecting blockage. And if of course there is some blockage, then he may undergo bypass surgery or an angioplasty or medical management depending on the severity of the disease. And besides that, also the patient would also need to do a lot of lifestyle changes, most importantly taking care of the risk factors, mainly diabetes, hypertension, smoking and sedentary lifestyle. These must be taken care of. The cholesterol levels must be checked. There are other newer risk factors also there, like lipoprotein A, homocysteine. These must also be checked. We see many of the young people are having high homocysteine levels these days. And if all these things can be taken care of in preventive health checks, when the action is taken before a patient has a cardiac event, that would definitely be very beneficial to the patient. So annual health checkups should be done, and there should be more educational programs, more health awareness programs, and I guess through the medium of the different modes of media like TV, newspaper, etc. People must be made aware of the severity of the disease and that we must take action before it becomes too severe.